All right, finally, we're here. We're now going to be looking into what it takes to pass the APRN exam. APRN exam at any level. Listen, there are no strategies without content. Absolutely none. You have to know everything and anything possible. The more you soak yourself in the content, the better you're going to be. Speaking here is Dr. Kehinde Elsiha, founder of FNP Certification Academy. To reach us, nurse-to-nursecoach@gmail.com. or info@npcertificationacademy.com. You can also visit our website at www.npcertificationacademy.com. So, what is the APRN exam really about? We have to know all the 5 nursing processes: assessment, diagnosis, planning, implementation, and evaluation. When you know your content, you're going to be good. We have 99.9% pass rate at NP Certification Academy. Let's not forget, if you don't know how to assess your patient, there is no way to diagnose properly. If you don't know how to diagnose, your planning is going to be off. If you don't know how to plan, your implementation is going to be off. And then what are you evaluating then? Maybe some bad outcome. So a lot of students want to jump right into, I need to know my form. Well, that's not the place to start. You have to at least know how to assess and know how to diagnose. Today, we're going to be looking into diagnosis, main diagnosis that students tend to stumble on, and what is the main difference between those diagnoses. I will try and keep it short, sweet, and to the point. Let's get started. All right, so the first one is major depressive disorder versus persistent depressive disorder. Listen, depression is what? An umbrella name. There are 4 main types of depression that will likely be on your exam. You're going to get MDD, you're going to get dysthymia, you're going to get PMDD, and then DMDD. But today we're going to be talking about 2 of them that are very, very close. That is the MDD and PDD. PDD, aka dysthymia. Listen, what are the similarity? For example, they carry SIGI caps, but the SIGI caps, though, is for different durations. I want you to pay attention to that. So what do they carry? So, for example, they have depressed mood. They have your SIGI caps. It can be any of them. And then it's kind of same as MDD. So that's a similarity. So what is the difference? So first of all, MDD, we have to look at this. The SIGI caps that we are counting is going to be more than or equal to 2 weeks. Does it make sense? The dysthymia or PDD is going to be what? More than or equal to 2 years. You have to pay attention to little things like that. So what connects them together will be written in your case scenario, so you must be able to recognize it. Does that make sense? So why does it matter? MDD requires aggressive treatment, meds, or therapy. PDD needs long-term management. MDD patients may be higher, may have higher risk of suicide. So you got to be able to nail the right diagnosis so that we don't further complicate the situation for the patient. So the ability to diagnose your patient is going to keep your work smooth, nice, and make you a good provider. All right. I hope you like it. If you like it, don't forget to subscribe to our channel or visit our website, www.npcertificationacademy.com, to get more details. At this time, we're going to be shifting gears to bipolar 1 versus bipolar 2 disorder, and I will see you in the next content.